Morning.
Good morning.
Good
Look, I think I
morning.
was a little ambitious. It just turned 9 o'clock. See what happens when I get real excited. I do stuff all out of turn. Good morning. Good
Good
morning.
morning.
Good morning.
Okay, wait. I didn't even welcome the people. Welcome to the people in Clubhouse. Good morning. Mr.
I
Jesse, are
already
you
put a
talking?
welcome note.
I can't hear
I
you
already,
at all.
I already put a welcome note in the chat.
Hold on. It may be me.
I can hear you. I can hear you.
You can hear him?
This is a little
So it
choppy.
is me.
It's a little choppy on my end.
Oh, you talking? I mean, you in the thing, but I can't hear you at all. I don't know if I. Hi, Asha. Wait, let me bring you in. You know me in technical difficulties. Lord, bear with me.
Y'all.
Hey. Okay, let's see. Wait, if I do this, see, I'm about to mess something up. Okay.
Don't mess
Okay. Can you hear me?
Yes.
I can hear you. Can the Clubhouse people hear me? I'm gonna need somebody to verify in Clubhouse that they
I
can.
can hear
I
you.
can hear you on Clubhouse.
Can you hear Monique on Clubhouse?
Can you hear me?
Yeah.
Say something else?
Can you hear me?
Yeah.
Okay, we're
Okay.
good then. All right, never mind. I plugged up something and I guess I didn't need to plug it up. Alrighty.
Well, everybody's clear, but I still hear feedback for me.
Okay, let me see.
I hear the feedback, but I think it's because if you have both of them, so I had to turn one down.
Okay. All right. I hear like air, and it might be me. Hold on. I don't know.
How you doing, Jesse?
Is that better?
I can hear clear. I don't hear any feedback.
Okay. Mr. Jesse?
Oh, I still hear.
Sir, you were the feedback man. Sir,
No,
sir.
I'm still hearing it, but if nobody else is hearing it, it's okay. We can move on.
Okay, cool. Well, welcome everybody. Let me get rid of this ticker here. I'm so excited. Wait, somebody else. Good morning, LaShanta. Good morning, Vicky. Can you guys hear us okay? Those are my normal audio checkers. Informal. They don't even know that they done got a whole job out here on our streets, but but they do a whole job, a whole non-paid position. Okay, well, welcome everybody. Let me get to the business of the day. Welcome to our Saturday morning tea, where we discuss health information, news, education, certification tips, entrepreneurship, and all the things. Anything that can come top of mind. You never know what may be discussed right here on this channel. I am Clarice Warner. I am the Grow with the Pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And let me first ask, do you know what it takes to be a certified marketable medical coder? Even if you are certified, do you know what it takes to be marketable? And if you think you're marketable, do you know what it takes to be certified? Well, before I introduce my co-host and guests, let me share with you information on a free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. All right. So if you are in Clubhouse and you are interested in more information on the 5 steps to become a certified marketable medical coder, then you can click the link at the top of the page. If you are on YouTube, Facebook, and LinkedIn, you can check the video description for the link for more information. So joining me today, I feel like it's been a month of Sunday, sir.
Oh, yeah.
Joining me today is my co-host, Mr. Jesse, the registered trademark, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Well, since we have ladies and
No,
we have
sir,
guests.
sir.
Okay.
Sir.
All right.
Sir.
My
You
name
the
is
co-host.
Jesse.
They the guests.
Okay.
Sir.
Okay. I'm just trying to be hospitable.
I know you are, and I appreciate the gentleman in you.
My name is Jesse. I live in Philadelphia. I've been an LPN for 29 years. In 2014, I transitioned into medical coding. In 2020, I created my LLC, The Coding Nurse, where I help other nurses and other healthcare people who have clinical experience transition into HIT.
Ooh, and how's that going?
So far, so good.
All right. I know every
I mean,
week we get an update.
Yeah, I tell you, look, these nurses fighting tooth and nail for their progress.
Sometimes you just got to breathe and be like, help me help you. Please help me help you.
That's all I'm trying
That's all
to
I'm
do.
trying to do. Bless their whole heart. Bless their whole heart. Thank you, Vicky. Okay. So let's see. Show everybody. We have Vicky who's joining us live. She's one of our regular folks that attend our live show. And we also have Miss LaShanta. Thank you, ladies, and good morning. And then we got a lot of folks over here in the Clubhouse. Asha, I don't know why I see you over here and not over here. I don't understand, but welcome. Hi, Latoya, Tanika, Candace too. You're supposed to be over here as well. And Rod, welcome. Okay, so you may see some new faces on the screen. Look at that. Look at God. Look at it. Okay. And there's a reason why we have some new faces on the screen. Today, we celebrate our 50th episode. Yay! So, as we celebrate 50 episodes, can you imagine? Who would have thought? But you take that first step and look where you keep going if you keep walking. All right. So we have invited several guests in various aspects of health information to join us today and to share and just to talk. And of course, do what we do, spill the tea. So let's meet our panel. I'll start with you, Miss. Okay, where did Asha go? Where did she go? Okay, I'll start with you, Miss Monique.
Okay.
Okay, but I'll start with you. Go ahead, introduce yourself and tell us all about you.
So my name is Monique Daniels. I have been a coder for the past I'm entering my 26th year of coding, or just in the field, period.
Clarice, speak up a little, please.
Okay,
can you hear me better now?
Yeah.
Okay, so I'm entering my 26th year in the health information management field. I currently work for the RAC, Region 1, Region 2. But I also have a business on the side where I teach people how to become certified coders. And that's really, I've been in all avenues. I've owned a billing company. I've done just about everything in the revenue cycle. And so now my passion is just helping other people for many reasons, mainly because we need them in coding.
Girl, you said a mouthful right there. See, okay. Calm down. Let the other folks introduce themselves. Thank you. Okay, Miss Asha, if you would introduce yourself and tell us a little bit about you.
Well, my name is Asha Johnson. I'm from New York. I am a fairly new medical coder, and I'm not sure what else you want me to share, Clarice.
Speak up a little, Asha, please.
Can you hear me now?
Yes, a little. A little more.
Yeah, if you could turn the volume up just a little bit.
How's it now?
That's better.
Oh, wonderful. So it was actually my computer, sorry. So my name is Asha Johnson. I'm from New York. I'm a fairly new medical coder, been in the medical field for a little bit now. I started out as a medical office manager, and about 6 years later, certified medical coder and a certified medical biller. So I'm here. Thank you for the invitation.
You're welcome. Thank you. Thank you. So I see we have a variety of folks in the space to give us some insight and information. So if you are new to medical coding or health information as a broad brush, or if you seasoned, I'll say seasoned. If you're seasoned and you've been here for a while, I'm sure that there is information here for you today. Let's see, we've already talked about how long you've worked. So let me ask you a couple questions, and to get this whole thing started, everybody is saying hi to everybody because we're all family here. You know, we talk on Clubhouse, or we see each other, and now we're getting to see some faces and names and all of the things. So I'm excited. This is great.
That's all of the things. That's the new phrase now.
Okay, so let's see. Oh, before I jump in, you see how excited I am. I'm all off script. Let me remind you, if you're on Clubhouse and want to join in and add to the conversation, please raise your hand so we can look and see. That you want to come to the stage, and we can add you up there. And remember, if you are on Facebook, YouTube, and LinkedIn, you can use the chat feature if you have something to say. Now, if it's a question, make sure you type a Q first so that we know it is a question and we don't miss it. And also keep in mind that, you know, this is our room. This is our space for us to discuss and talk. So don't be shy. Your opinion matters, and of course is welcomed here. So by all means, come on and join the conversation. So for those of you who are just joining us today, we are talking about the 50 shades of health information, serving a variety of tea with honey. Trust me, it took a long time to come up with that title. We have a panel of health information professionals with a variety of experience and background, and they are in all areas. And again, Asha and Monique, thank you so much for joining us today.
Thank you.
Mr. Jesse, you a regular co-host, so you're always here. But before I get started with all that, how are you doing? You good? You know, we all sent up prayers.
Yeah.
Okay. Make sure you good.
I had some medication changes, and I told you I was using my new insurance.
I hear you. Did that all work out?
Yeah.
Okay. So let's talk about some challenges or some challenges. So what is the biggest challenge you may have encountered in your current or past role in health information? And how are you, or if you already overcame it, how did you overcome it? I'll start with you, Asha.
Well, can you guys hear me well?
Yes.
Can you hear me? Oh,
Yes.
So I know on Clubhouse saying the volume was pretty low, so I was trying to balance everything. You were saying something, Jesse? Does it sound okay on your end?
No,
I wasn't saying.
So one of my issues was doing all the work and not necessarily getting compensated the way I thought I ought to be compensated, as well as even the recognition. So where I'm coming from in the medical space, what I did with my team essentially paid for the entire services of the campus. So Medicaid paid us to take care of 75 plus children, and I'm getting maybe a percentage of whatever I'm doing. So they have to audit our medical records, basically saying, okay, to prove we're giving and offering the services for the medical needs for the special needs children that are in foster care. And based on that, the audit, usually they either take back money or they see that we're doing what we need to do sufficiently, and they'll give us perhaps even more money. If that's something that my team collectively is doing well, then in my opinion, then I should be compensated the same way or even rewarded. So if it's a good audit, then I should be compensated for that. So then I start looking around. So can I work remotely? What else? What kind of notifications? What to go back to school? Like, what do I need to do for myself in order to not get in that situation and continue to be comfortable with the way I was treated? And it doesn't mean that I didn't love what I did. I absolutely did. But what else do I have to do to make myself a better person? Maybe somewhere else that I'm more marketable. So yeah, so when it came up that I could, and oddly, the nurse manager.
Okay, you're on. They can't hear you on Clubhouse.
On mute? Am I muted? Oh goodness. The feedback is horrible on my end.
It is. Hold on. I think I. Hold on. No, it's both. So mute on StreamYard.
Okay. That's, I don't know if that's going. Oh yeah, that's nice.
It's much better.
Okay. Thank you for helping me figure that out. I hope I'm better now. Cause I saw that they were saying they couldn't hear me.
It's still
some feedback though.
How's now?
Do you have headphones that you can plug into?
She got one on.
Oh.
Okay, go ahead.
Yeah. So
And
now I don't hear it as much now. How do I sign on Clubhouse, guys?
It's still there, but it's a lot better than what it was.
Yeah.
Okay. And
So
my volume is okay?
It's great now.
Yeah. It's better.
Thank you. So yeah, long story short, recognize that I wasn't getting paid is what I thought I was worth, and what I wanted and desired to be paid for the level of services that I was rendering to the facility and to my agency. So when it was suggested that I go back to get or consider getting my certification because of how the medical field was going to be compensated, I went back, I did that, and ultimately am here in medical coding. Now, what are my challenges here? I thought it was going to be easy over here, and it wasn't quite what I thought it was going to be. So namely, there's not a lot of us that are pigmented, to say it nicely. There are not necessarily a lot of females in the role. And there are not a lot of people that are educated and certified. So they're experienced and they were taught by people who are experienced, but they don't necessarily have the education and the certifications that I have. So being the new girl on the block, probably a little bit younger than some of the new nurses and whatever that come out into the field. There's some opposition. Who do I think I am? I get that feeling in those interviews. But thank God for avenues like this that I found with people that know and see what I see. It made it a lot easier. So I wasn't making it up in my head. I absolutely knew what I was feeling. So when I came through with you guys on Saturdays and heard you guys talking and was able to share and pretty much got, yeah, that's kind of how it is in the field, you know. I was like, okay, I'm not making this up. This is really how it is. And even now being in a hospital, which I thought would be even better, because there'd be so many of us, what's the problem? It's still the disconnect of, it's almost like it's a power struggle. I know here we call it sort of a gatekeeping, but it's what happens.
Cool. Okay. And Miss Monique. Okay, let's see what we got as far as. Oh, I'm muted. Hold on. I forgot I muted me. So Miss Monique, same question. What is the biggest challenge you have encountered in your current or past role in health information? And how are you or did you overcome it?
So do I need to be logged into Clubhouse as well too?
Are you in there?
No.
No. I can hear you, but I'm hearing feedback from somewhere. Okay, somebody did something, so there's no feedback now. Can the people in Clubhouse let us know if you can
Is that better?
Miss Monique?
Say something else, Monique.
Huh?
Can she say something so we can hear?
Oh, she was frozen. Go ahead.
Oh, good.
Okay, Miss Monique, can you
hear me now?
Yes, I can.
I can hear you all. Can you hear me? Okay. The biggest challenge for me over the years has been finding quality coders. A lot of these schools just push out coders like a factory, and then you get them into your organization and they know nothing. They can't code, they don't know guidelines, they just absolutely know nothing. So then you become an instructor versus a manager or director. And that has kind of been the trend amongst coding for me over the past 26 years.
Ooh. Not a whole 26 years of folks just
The whole 26 years.
Right. Clubbing into your face. Oh my God.
I felt like man down, shots fired.
I know. Like, oh my God.
That's how you feel about Miss Monique coming into the field? Talk to me.
It's funny because I came in like old school. So I used to work at a hospital as a medical records tech. I was chasing down the providers, getting them to sign their charts. And then one day I saw all these women in the back room and I asked my director, I said, what are they doing back there? And she said, they're medical coders. And I was 17 at the time. And I said, what is a medical coder? And she said, go ask them. So I've never been shy. So I go back there and I said, what y'all back here doing? So this old lady, she had to be in her 60s at the time or 70s. Now I'm 40 something. I don't think 60 is older, but you know, when I was 17, I thought 60 was just the end goal. So she said, come here, girl, sit down. And I said next to her,
y'all, she won't even give it up.
42. I just turned 42 last month.
I'm messing with you, Monique.
And so she said, come sit down, girl. So I sat down next to her and she showed me the systems and she showed me what she was doing. And I said, oh, I want to do that. And she says, okay, every day, ask the director if you can sit back here for 2 hours every day and I'll show you how to code. And that's how I learned how to code. Better instruction than any school I've ever been to, than any class or course I've ever taken, because it was that I want to help you. I want to see you grow in this field. And that's kind of the approach that I take with my students and my employees, is that it's that passion for coding. And I feel like coding has become a money cow for some people. And so you lose the passion because you just want the money now. You want the contracts. And I'm not saying nothing is wrong with that, because everybody wants to get those coins. However, you have to have some of that passion directed behind coding as well, too.
I'm laughing because we just talked about the passion of coding, passion and health information a couple of weeks ago. And it's like, you can get into this all day long. And if, you know, you don't, if the passion is not there, it's going to feel like work in order to have to read these guidelines and stay on top of things, because you got to do it. As we all know, things change all the time. And to be on top of your game, you have to be in the know. You have to be knowledgeable about it. That means being a lifelong learner and learning and reading and all of those things that come with that. And if you don't want to read, maybe you way in the right field. But if you don't have the passion to want to get more knowledge and want to get more information and want to make sure that you're doing the right thing to help not only you in your career, but help the organization in which you're working for, then what looks good may not be good for you. So
I had a lady pay over $3,000 for a course that I teach. And the fourth weekend, she says, I don't feel like reading no more.
Oh my God.
But that's okay. At least she knows now.
Yeah. And I said,
better than
okay.
wasting your time and hers.
Exactly. I said, well, this is a non-refundable course.
Amen.
As per the contract.
That part.
I wish you well.
Oh my God. Oh, amen. Amen. Wow, that is crazy. Crazy.
It is.
But I'm glad she knew who she was.
Right.
She knew who she was, and was able to at least tell you going down a lot, because that would be okay. I don't know if it's me. That would be frustrating.
See, I'm on the other end of the frustration where not too many people were and are, and I've said this to even Clarice, like it's so hard to find what I would consider mentorship coming out of school and certification. So one of the things that concerned me is what what excited me in the first place kind of gets watered down when you're running up against this wall where you're not finding people that want to take in a new person because they're very concerned about what the person knows. Or like I come in with the certification, so maybe they think I come in with bad habits. I don't know what it is, but then it's like, how do I get into a space where I can be where I feel comfortable, trusted, and then mentored? Because this is really what I want to do. So I applaud you, Monique, because you're offering, as much as you said it's hard, 26 years.
So, Monique, you really opened up
that person that stands
a
into
can of worms
space
in that.
because there are people,
especially.
And I'm now thinking like, imagine if somebody had introduced this to me like they introduced this to you at 17.
Go ahead. I'm sorry.
That's banana. Like to me, that's bananas. I'm sitting over here in New York. Like, really? That's how they did you nice? They did you real nice.
So you
opened me real gangster when they did you real nice. So I'm like, it's. I guess it's just different spaces and different times also.
So you opened up a whole can of worms when you talked about the quality of coders that you are receiving in over 26 years. Oh, bless your heart. And you still here and stuck with it. I applaud you for that. So let me just say this. In my latest YouTube video, I actually I think we've talked about this several times. I attended the AHIMA 22 Global Conference because it was right here in my backyard in Ohio. And I also provided a few takeaways in that video. But one of the things that continue to stick with me in that particular discussion is about workforce changes. And so there's a lot of buzz and a lot of talk regarding that. Okay, I don't know why I'm hearing feedback, but I don't know if y'all hearing it, but I'm hearing it. Oh, it's driving me crazy. But anyway, there was even a whole breakout session on that topic. And of course, this is not new. We've seen and heard about the different things and different pathways you need to go as the profession changes. We got AI coming in. We have all other types of automation. And then, just new positions and new jobs that are morphing in our field. So we've been here before, but because of all the things that have happened to us in the world in the last couple of years, it just, for me, it feels a little different. But I just think, it's something that we should talk about. So one of the presentations, or that breakout presentation, was by Eric Nordgren and David Mark, and it was titled "Paving the Way for Future HIM Workforce Needs." And in that, they mentioned a study that they anticipated a lower percentage of time on diagnosis and procedural coding, and that tasks such as leadership, teaching, and informatics will significantly increase. And I want to know from all of you, Mr. Jesse included, do you agree or disagree with that, and why? And I'll just jump in at once.
I agree.
Ladies first.
Yeah, I agree. We're moving towards a time period where technology is becoming a lot more advanced. Our CACs and just our coding tools are becoming a lot more advanced to where we have systems that can scan the record and pick out a chart and then, I mean, pick out a code. And then the coder is there just to verify if that's a legitimate diagnosis code or procedure code. So the onus then becomes on leading that team and actually making sure that, like, I work for facilities. Well, now I work for recovery audit contractors. If people in the audience don't know what that is, we collect money for Medicare. We go through records and we figure out if hospitals and different organizations are coding and billing correctly. We do line item coding. We'll go through drugs, I mean, everything, just to see what we can recoup for CMS and Medicaid. So the onus is on the leadership now. How are you driving this team, especially with coders having so much opportunity and flexibility? It's hard to manage, and then being remote, it's hard to manage these teams. So I really do feel like that we're going into the direction of we need more informatics. It's the data. It's the data. Whenever I'm going into meetings, they want to know about the data. And it's and also teaching. Like, we just don't have enough teachers. I come from a generation of coders that used to just code everything that the physician wrote, regardless of what it was. And now, and Jesse can probably attest to this, we have to know clinical indicators. We have to know substance 3 criteria. We have to know what hyperperfusion means. We have to know what organ dysfunction means as coders. Otherwise, we are not successful. So it's the face of coding is changing, I think, for the better. But at the same time, it's leaving behind a lot of people that are stuck in that facet of that's clinical. I'm not clinical. You might not be clinical, but you better understand it at this point in the game.
And one thing we talked about even at the conference, somebody, he's one of the leaders. I see his face. I can't think of his name. But he was adamant and saying, stop saying that you're not clinical. Because when you, especially if you went through, depending on how you got to your coding career, and if you went to a college, you sat next to the nurses, the techs, everybody in those initial clinical, pathophysiology, we even had to take pharmacology when I went to school. See, I'm dating myself. Wow. We had to take pharmacology when I went to school. So all of those things. So you sat arm in arm right there with clinical people too and gained the same knowledge. And so he was adamant to stop saying that you're not clinical, because you are. You are.
Yeah.
Mr. Jesse, did you want to weigh in?
Yeah. But the Asha want to weigh in?
Probably afterwards.
Okay.
I feel like I'm the new kid on the block, so I got to listen in too.
Well, me personally, I think that if coders aren't careful, coders are going to find themselves without jobs, because nursing is taking over coding. I see it every day. And just your last point that you made about clinical, about how coders should see themselves as clinical, I totally agree. But in the real world, it's not like that.
Mm-hmm.
I work now. I've finally got an inpatient CDI job. And where I work, coders cannot even send a query. They have to contact someone in the CDI department for them to send a query. Mind you, most people in CDI are not coders. They are RNs who have a CDI credential.
Mm-hmm.
They don't know anything about the uniform hospital data set, what it says about discharge data set, about what it says about what is a principal diagnosis. There is a legal definition to what is a principal diagnosis. There's a criteria that has to be met. And to trip you out even more, my preceptor is a doctor. And his viewpoint is very interesting when we go over charts, because he looks at it from a totally different standpoint. He's not a coder, but he doesn't refer to coding guidelines. He doesn't even, if whatever that encoder tells him, that's what he does. And I go to the encoder, I go to the book. I'm old school.
Absolutely.
Me too.
So
Absolutely.
I don't need an encoder because I want to read those instructional notes. I want to read them exclusion notes. I want to see what's going on. And I just don't I don't like what I'm seeing because I see it just as sure as my name is Jesse Gallup. It is going to be hard for coders in the next 5 or 10 years because especially the way, and I'm just going to say it, the way white women are leaving nursing, it's it's gonna be a mess because they're going to move them. They're going to move them to those cushy positions, to those 85, 90,000 dollar positions, and you're going to be stuck, trying to find something. No. Mm-mm.
Or
I
push
think
down to a production position where
I
your head, you're still in this bump. You're still in you're bumping your head up.
coders better get on AHIMA's behind. Coders better get on AAPC's behind and say, no, this industry is being taken over by nurses. They don't have the coding background. Because truth be told, if they had the patience to do coding, they would take it over. But coding's
They
too
would have
hard for
done
them.
it already. Yeah.
It's too hard for them. They ain't trying to think like that. Because see, they want to be all cute because they got to do the RN title. They already think they saving a day.
Oh my God, you going in?
Where's my? I need my
Right.
scarf.
Right.
It's the truth.
So it's the
What I
truth.
see. I'm
But
telling you,
remember, I said that when I came into third party billing, and I said they are sending some of these out to RNs who work part time. They don't even have the nerve to hire them full time, and they don't need to because they get paid so damn good. Excuse me, darn, good. They don't have to work full time to do what we are getting paid to do. And most of the people I worked with were not certified billers or coders. So some of what you guys are saying on the coding side of it, like I get it, but I also know on the billing side, the insurances aren't paying for all the details of all the things that are being coded. The insurances are like, we'll take this, we'll take that, we'll take this, and then they all the rules in between it. So it's nice to know. And Jesse, you called it when I first came into the room. It's very threatening for me to be in a position to understand what I'm reading because of all of the clinical stuff that I had to learn, but then to be on the side of billing to say Blue Cross Blue Shield ain't having that. So if y'all really want to get paid for this claim, it's got to look like this, and maybe this. Like they don't like that. And forget it if you get it for other insurances. Like if you at least know one and you master one, then they're all right. You're not too challenging. But God forbid I learn some other ones. They if they don't like me now, they're not gonna like me later.
So do you all think that will be obsolete in the future?
I don't think it'll be.
No.
I personally don't think so. I see what they're doing with even in the hospitals where they're putting the bots out. But a lot of the stuff that's coming up with the bots is coming up because you have people who are not traditional coders or billers. They are literally like a factory, like Monique had said, it's like factory learning. You learn what I tell you to learn of this part of the billing cycle. And then the mass push out is this is how many claims I need you to process per day. And that number is getting larger and larger. So people want to keep their jobs because they want to eat. That's just the reality. This is not about a love for coding or billing. This is now I need to keep this job with this benefits in this hospital so that my family can eat and I can pay my mortgage. So now when it gets harder, now we're demanding that the company provide bots. Now the bots are supposed to be activated to do some of the processing. And sometimes the bots aren't as accurate either. Sometimes hiding behind the bots is some guy from another country offshore. So if we really, that's where it's going. But they're calling it bots. Am I telling too much? Okay, let me
I think that goes back to the quality portion of it. It speaks volumes to the quality portion of it. And coding has become, like you said, a factory. And a couple of months ago, I had an ALJ hearing where in downtown Atlanta, and the company that I was working for, the hospital that I was working for, we were suing Medicaid. And so their lawyers and their people came and their medical director came. And so as we were reviewing the courses, our attorneys were asking me questions about validating the codes, the clinical indicators to validate some of these things. And the attorney for Medicaid said, "Are you a doctor?" And I said, "No." He said, "Are you a nurse?" I said, "No." And he said, "Well, what makes you qualified,
What gives you the
you know, to
authority?
speak on these diagnosis codes?" I said, "Because I'm a certified medical coder. And my job is to go into the medical record and to determine if these diagnosis codes are clinically supported in order for me to code them per coding guidelines and coding clinic." And he had nothing else to say to me. But we are not creating a generation of coders that can, when pushed up against a wall, that can sort of fight their way out with clinical terminology and clinical indicators and so forth. It goes back to the quality of coder. These schools have made millions and billions of dollars teaching people how to be medical coders and billers, but not giving them the knowledge to actually survive in the field and be replaced by these bots and be replaced by offshoring and be replaced by nursing. And like Jesse said, we have to fight with AHEMA because I pay way too much money for the credentials behind my name to the AAPC and AHEMA for us to be overtaken or replaced by nursing. And I'm not saying nursing don't belong in the field. Huh?
And can I just want to throw in something else, because it's not just like, don't just think it's just coders, because I'm an LPN.
Mhm.
I was in train. My preceptor told me he was talking to our supervisor, and he was telling her how quickly I'm catching on to things. I mean, I done had a gazillion jobs. I mean,
Mhm.
you know how we do anyway.
We do.
So so he's telling her, oh, he's really catching on. He's doing a good job. So her response to him was, oh, well, that's good to hear because I've never worked with an LPN in CDI. Now, she interviewed me, she and her boss. Now, if you see my resume, I got 17 initials, 17 letters after my name. You just skipped over all the other bull crap I got. You wanna fix in on that because that's what separates me from you.
Yeah.
I'm like, this bitch. But excuse me, I'm like, see, no. Mm-mm.
But let's
That's
be
what
real,
I'm talking
Jesse.
about.
That's how I
Automatically.
feel. Remember, I said I was thinking to go get my LPN because of that. I said it makes no sense for me to be undermined consistently among even nurses in the hospital who said, well, why do you got to take anatomy? And why do you got to take? I'm like, well, how do I know what part of the body y'all talking about?
But
I don't care what nobody says. LPNs do all the work.
CDI trainer and ICD-10 CMP. I got credentials after my name, but you want to focus on that because you don't have that. You have this RN. Big deal. Because at the end of the day, what you're doing is based off of physician documentation. You ain't using no judgment and no coding. Coding does not allow for judgment. So your initials mean nothing.
And Monique, that part, LPNs, they're the ones that are actually out there doing the hands-on work.
Yeah,
exactly.
Just, I'm telling you, I can't. I'm just done. I'm just sick of it. I really am.
So what do you all think that we need to do to what information or what skills do we need to impress upon these new coders who are not interested in being stuck in this production wheel, but really want to branch out and will use coding as a stepping stone, if you will, to branch out into other areas, or even teaching or management or what have you. But what do you think? What how should we advise? How should we help them get to that level where they're not stuck and help them see the writing that is truly on the wall? Because this bot thing is
real.
crazy to me.
But for me, it's the connection. There's a even and I said to you guys in school, because I was coming just about finishing to get ready to prepare for my certification when we all met. Believe it or not, it was not that long ago, but it was that long ago. And I didn't depending on, and I kind of recognized that the support I got even in school from different people and what they look like translated even into the real world. So I got the same level of respect from certain professors that I got when I saw the people that look like them outside of school. There's not a community. That's where I rest. There's not And if there is, it's kind of scattered and we kind of have to find each other like breadcrumbs and come together. But I don't feel like there's a strong enough community, even under AAPC and AHIMA. So a big mouth girl like me, people be all right with, who feel like that, because everybody isn't necessarily, it's not like the same song, same sound, same band. We're saying it, but we're saying it in different places. We're not necessarily saying it as a community. Even there's girls that I've graduated with that have also now certified, and it's almost like we're desperate. So again, the community we had as peers, we no longer have. If I was, and I'm a gatherer, I like getting people together and keep like to study. If I text somebody now and I know they're doing well and I'm doing well, crickets, like why? You know, they went back into that same idea. But if somewhere along the line, that community and that sense of organization and belonging to and being able to somehow function and thriving together, it's just not there. Monique, I literally did not get what you got. I got that here on this channel. I didn't get that anywhere else.
It rarely exists,
In the world, I've witnessed Asha come through here, sit with me for an hour. Let's code together, even for free, so that I can mentor you and get you into a place that I and you are confident when you go out into the world to be a successful coder. That doesn't exist. And I and if it does, y'all show me. But it doesn't exist.
We live in a time period of knowledge hoarding. And it's amazing because everything is accessible by Google. You know what I'm saying? If I want to ask something or know something, I can Google it and I can get the answer. But we live in this space of knowledge hoarding and of competition that really shouldn't exist to a certain point. The way coding is going to stay alive and preserve itself is by the coding nurse, by PRN Coding EDU. These are the organizations and the businesses that will keep coding alive by that teaching and that helping and that knowledge sharing. But people are just caught up on their own thing. LaShanta, I am a CCS, a CPCI, and a CPC.
What I almost think needs to happen is, I think like in every other profession, I think we need to have Black coding associations.
That's what I mean, like the organization.
Yes.
Because if you expect some white women in the suburbs to address your issue at a meeting, it's not going to happen. Now, if
they don't even want us there.
Maybe gonna date your girls.
They don't want us there. They don't want us at the table. When I was coming into coding was a Black profession, and maybe it's because I'm from Michigan and close to Detroit, but every coder I knew, they were Black women. They were older Black women, or, you know, coming into the field. Coding turned around the early 2000s, mid 2000s, when I think white housewives realized that there was money in coding. And then it became one of those things where it was a career move for them. And then because of their skin color, not because of their credentials and their education, but because of their skin color, they were pushed into director roles. They were pushed into VP roles. And then they started these fast track coding companies. And once again, because of their skin color, they were given contracts and, you know, they contracted with these companies and so forth. And so, like Jesse just said, as Black people, we need to make a stand and kind of take back what's ours. And men, there weren't that many men in the field either. It's funny that Aisha said that it's full of men, you know, and when I was coding, it was like one man, like one man. And
they're
now,
Indian. They're
and now it's inundated.
mature immigrants. They're not even men from like the American men literally dropped out of the course, but the Indian men talked down to, and they're sexist. It was,
and they don't know how to code to top it all off. And that's kind of the thing that I struggle with in this field, is making a voice and I live in Georgia, where my family is relocating to Arizona next month, but I live outside of Atlanta. And one thing that I love about the Emorys and the North Sides and the Piedmonts is that you see us. We are in positions of power, so to speak. But we are not at that executive level. They'll put us in management and director, but we're not VPs. We're not CIOs. We're not at that executive level. We have to come together to create that.
And we have to fight. Trust me, I've been at that executive table and look around, and there is nobody around but me.
Right.
and having those conversations to advance and showcase. Look at the skill set. We got folks that certified and been here forever and know what they do and are not afforded the opportunity or given the chance to excel in those jobs. I say this all the time. If you are a mother, being biological or not, you could be a dog mom. If you are a mother of any kind, or father, or parent of any kind, you have all the skills you need to be successful in any leadership, because you got time management, you have project management, you have all of those things. You've worked those and lived those all the time. I'm gonna date myself too, because way back in the day when I came in the 90s into this profession, they were it was the gatekeepers of that day were also older white women, and gatekeeping not only in the job market, gatekeeping even in the educational space, trying to, this was people didn't know about this field because they were keeping it to themselves and wouldn't tell anybody. You just happened to like roll in and stumble. And I think some of that is still happening today. I think it's a little bit better, but back then you would have never known. Well, what is this part about? It was all, right. Well, go and be a tech, go and be a nurse, go and be whatever, but not even involve yourself in this area of health information. And to Monique's point, once the floodgates sort of open, once they cracked open a little bit, then it was like, oh, well, we'll open it up because we're about to leave this and we're going to the higher level positions, but we need somebody to do the work. So we're going to have to backfill that work. So let's open it up so these folks can come in and then we just step up and manage. And then, but never was there any information, opportunity, education, training on what management looks like. So then you bump into you have no idea how to manage people. You have no idea how to be a leader in your field. You just migrated over because it made room for other people to come in. But then when you get people who come in, who have the knowledge, who have the skill, who may even have managed, they may not have managed in health information, but they may have managed in other areas or other positions that they've had. Now you feel intimidated. And now you want to push that voice that, oh, they don't know what they're talking about. Oh, they don't this and the other. So then we, unfortunately, have to work harder and make sure we get, to Mr. Jesse's point, 17 credentials behind our name to have all these additional to say hello, even though they may only have one.
If they have the one.
But they, but have the confidence, I guess, if you will, or have the backing to say, well, they're the expert and they know. Not necessarily. Just because they're the person that you quote unquote may see, that's because the person that has the ear at the moment does not necessarily mean that they have the knowledge base, the wherewithal to be that leader in that space. Again, they just migrated. So now, to Asha's point, it's getting even bigger because you all know that health information and the business of health information is now global. And so other countries are now kind of adopting our model as the reimbursement space for healthcare. A lot of these countries have socialized medicine, and so their things were a little different, but they're looking to see, well, how can we change the needle, and how can we kind of get other people and these healthcare provider or payers involved to assist in paying for some of this, so it's not like necessarily on the government in these other countries. And so they're looking at our model as kind of the gold standard or the best practice, if you will. And with that comes these opportunities for coding and or billing positions for people who have no idea what the levels, the layers that are involved with that. So somebody threw them a book, or they done went through a class and they think they're the know it all as far as what it is, but can't read a guideline to save their life. Didn't even know the guidelines exist. Didn't even know that there was additional, to Monique's point, just taking a few moments to go out and do some research on the internet or Google can provide a wealth of information and a wealth of knowledge. Don't even know the foundations of what it is that we do. But again, want to be the expert, want to teach somebody, and then want to take the leadership position. I mean, if I got 5 on membership into the Black Association, which I
can match that.
Speaking of guidelines, like I just went through this about a week and a half ago. My class, I gave them a final, and you, as an instructor, we all know, who's going to pass and who's not, because you know what they get. So, true to form, this woman did not pass. So I give everybody 2 attempts. So what she did was she tried to set it up like, I was a problem. So the week before the final, I was condescending. She never said anything about it 7 weeks prior, but I'm condescending. Mm-hmm. So, so she was like, well, I just have a hard time talking to you because you don't know how to talk. You don't know how to talk to people. I said, oh. I said, so is that why you don't know? I said, so I'm the reason why you can't read a guideline? And you
on your own time at home.
And you're a whole registered nurse with a degree? I'm the reason? Really? I said, well, okay, well, if I'm the reason, how come you never told me? And how come you never put it in writing? I said, so I'll do one better. So now she called herself not trying to talk to me. So now everything's in writing. So she failed the final. I told her what she had to do. When she resubmitted, she still got some questions wrong. Here she go. Can you send me the answer key so I can review what I got wrong? I said, in what world have you ever got an answer key to a final for any exam you've ever taken? So I don't do that. I said, if you want to discuss your test, I'm more than willing to do that. I ain't heard from
you. And you won't.
Exactly.
And you won't.
Answer key? The whole answer key?
Please.
That's what you're working with?
Mm-hmm.
It's funny, Clarice, because I was sitting at an executive meeting and the director of coding asked me in an executive meeting, what's the outpatient DRG for this account? I said, excuse me? I said, can you repeat the question? Because I need you to repeat that. She said, the outpatient DRG. I said, outpatient doesn't have DRGs.
That don't even make sense, man. What did you just say?
And that was our director of coding.
Wow. And then that used to drive me crazy too, because especially in the compliance space, they'll get a little buzzword from somebody in HIM and want to use that buzzword over, and I'm like, you don't even know what that means. You don't even know what you're saying, sir and ma'am, at all.
Right.
Be careful with the pronouns now. Don't get yourself in trouble, Clarice. Then you're fighting with coding and pronouns.
Lord,
but I think moving forward, in the interim, the advice that we should give all new coders is plan on getting another credential. Don't just realize that you cannot just be a coder anymore, but for a certain amount of time. You have to go into auditing. You have to go into another area. And Tanika had put in the chat to go into the IT side of HIM. That's the best advice, because that's my next move. Because when I tell you, I'm done.
I'm in the process of rebranding my business. So JA Coding Solutions is my current business, but I ended up creating another LLC and doing all that called the Coding Firm. And the reason why I chose the Coding Firm is because it encompasses everything. We're going to do IT, we're going to do informatics, we're going to do teaching, everything, because that just doesn't exist. It's just It just doesn't exist. And IT right now is the driver. If you create an app that can do something special with coding clinics, or you're a millionaire overnight. IT is where to be.
Let me tell you, my job that I just started, I had 2 whole weeks of nothing to do because a program wouldn't open up on my computer.
That's happening.
Do you know what the fix was? For IT to go in, uninstall it, and reinstall it. 2 weeks.
I'm surprised they didn't tell you to shut down or restart. That's what our IT department always say. Did you reboot?
But guess what? But I sat
that
there
happens on a hospital level too.
I sat there and collected every penny of my salary.
Oh, I don't blame you.
Right.
I don't blame you. It's not your fault.
I'm reviewing all this material that you gave us to read. I sure was.
And I talked about a couple of weeks ago, and I'm still going to do some additional research and finding some people of color that have morphed over into the IT world, health information IT, or health informatics, if you will, just to see what their path was and how they did. I think that would be a great conversation. So I will, and if you guys know anybody that would be willing to come and talk to us, let me know, so we can get some of those folks on the call, on the channel, on the video, in the room to spill some of that tea so that we can be prepared. Because I always believe in being proactive versus reactive. And we're at a point where, definitely need to be proactive on next moves. Because this right
change
here
is coming.
This tea that has been spilled to me today, Lord, is just off the chain.
Yeah.
Change is coming.
They're creating franchises where it's electronically processing bills. So the people that it's really just about money. So if you have the money and you can afford the program, they're not even, I don't think that they're crazy expensive, but you do need to have some money. And they're not charging you even per regular franchise. Like most franchises, they'll say monthly on top of whatever lump sum you started with and comes with the training. They'll then say like how many thousands of dollars you should pay monthly. With the franchise, because now they can't even call it really a franchise, when it comes to medical billing and coding and whatever, they're getting paid on the back end of the processing. They don't care about your front end money except for you buying into the IT program.
Right.
So now that's a whole nother thing. So when I did a seminar type of thing, and I'm asking one of the ladies that started her business, she now, she works offshore now because she can afford to do that. And I'm asking her technical questions that I would understand with coding and diagnoses. She has no clue. What happens when things get bills or claims get rejected? How do you manage them? She's like, she doesn't know that she has those problems. She doesn't know how to handle them. Well, how do you work? So now the guy is like, well, do you have, like, what background do you have? She has business administration background. She has no medical background. She's never worked in a medical office. She just has, like you said, Clarice, she has management skill set and a degree. And now she has this business where she pays people where she doesn't have to pay them $20, $30, $40, $50 an hour. She somehow can afford to pay them $10, $6 virtual, remote, and she collects the rest of the money. So that's the stuff that we're looking at on both of these ends, that it's a lot more affordable because of technology to process claims and bills. And some of these people don't care about the rejections because they don't have to deal with them. That's not where they're coming from. They don't, like, I care. That's not her end of the business. She just wants to get paid and she wants to be able to run her business. So even on a franchise level, we see where IT is creating a situation with non-medical people who just have a desire to make money.
The average owner of a urgent care is not a doctor. The average
Most
owner
educators
of
are not
these
prepared.
clinics, they're not doctors. They're IT people or they're real estate people, and they're not physicians.
Like business
Um,
financing. Yeah.
yep. At the
Mm.
hospital I used to work for, going back to automated coding, series accounts. So our patients that come in for the same thing, for whether it's a blood transfusion or something to do with their cancer, but if they have the same diagnosis code and they're just coming in for a single treatment, we don't even code those no more. Those are automatically coded by the system.
Yeah, the bot will automatically set it up.
Coders don't even touch them anymore.
Mm-hmm.
Wow.
Mm-hmm.
So it's coming. It's here. It's not coming. It's here.
It's here.
It's here.
Yeah.
It is here.
So, Clarice, Tanika wanted to come to the stage. I think she wanted to talk about healthcare IT.
Good morning, Tanika.
Come on, Tanika. Come on, girl.
Good morning.
Good morning.
I said IT because I don't know if you guys remember when I first came into you guys' room in Clubhouse, I told you that I was losing my passion for coding. And behind that there's a couple of things that we spoke about that is the reason why. But for me, I guess the icing on the cake was when the hospital that I work for currently, my manager, we had a position open for over 6 months for inpatient coding, and I do outpatient. And so I asked her, could I start to train on inpatient, just starting off with L&D? And she told me, her response to me was, no coder can do outpatient and inpatient. And I'm like, why? She couldn't give me a reason why. She was like, it's not feasible. It's not possible, basically. And I was like, well, I just to help the inpatient coders out while we are down, I'm asking to learn the basics. She would not allow me to.
They won't cross. They won't cross train.
Yeah, exactly.
They won't.
But our hospital has been without a coder, inpatient coder, for well over 6 months, and they were drowning.
And that's what they're pushing. Believe it or not, right now, that's what they're pushing. They're pushing that. Oh, there was a term for it. Oh, I can't think of the term. There's a term that they're pushing that coders be able to do both, and that they use them for both.
Right, because they don't want to pay you for both.
That's a leadership issue.
I wanted to just basically learn that, because even if they weren't going to pay me, I was going to, make other ways for that. I wasn't at that point, right where I was at that point. It was for me just to get the experience on the inpatient side, to have something else underneath my belt. And the reason why I was saying the IT side of it, because to be honest, from the people that I've, whenever they transition to the IT, well, the couple that I have spoken to in the past, a lot of them, if they have any type of coding degree, they've never used it. They solely just, off of the IT side, that's where their experience has been, or that's their knowledge. Or even if they, like some people will do the oh god, what do they call them, the HIM analyst, where you have to go to, like, if your hospital has Epic, and you have to go through Epic for that training. A lot of them didn't have IT experience or coding experience. They were just at the right place at the right time. They needed those because, of course, once you have Epic, you have to have a certain number of people to support Epic. So hospitals or facilities have to find people to fill those spaces because it's a requirement for Epic.
Mm-hmm.
One of the guys that helped me pass my CPC, he said straight, working for the hospital that I work with as a coder, he doesn't use his books. He doesn't use his guidelines. He uses a computer. Everything is pretty much tap, touch. So for him to tutor me, that was work.
It's stories like yours, Tamika, that really bother me, because what you're experiencing is a leadership deficiency. So any leader in a hospital setting will tell you that when I'm not there, my staff should be able to function as if I'm sitting right at my desk online with them. So when someone comes to me and says, I want to learn inpatient coding, or some of my inpatient coders, I want to learn outpatient coding, or I want to learn IR, or so forth, it is my job as a leader to ensure that they can take whatever path that they would like to take. If that means cross training, if that means, you know, me being able to buy classes through Leaving, or whatever the case may be, as a leader, that's what I'm there for. One of the things that
yes.
But why isn't it like that in this industry? That's the part that bothers me. Like,
it's ego. So and
they don't want anybody to have more knowledge than they do. They want
ego.
But this ain't even about you.
Yeah,
they don't want anybody to have more knowledge than they do. They want to be the big fish in the little pond. And so they want to keep all the other fish swimming around so that they can be the one on top of the food chain. And it's like, no, a good leader knows that they succeed when they have good people who may be more knowledgeable than them around them. A good leader knows that, and a good leader will give anybody the skills and training and information that they need to go out there and fly, butterfly, fly. A good leader all day. Because the thing about that is that person is going, usually, that person is going to remember. Somebody told me I could do XYZ. Somebody gave me the opportunity to do XYZ. And then take that and pass that along. And that's something that I know in our community we're missing, because we unfortunately had this whole crabs in the barrel foolishness that goes on. But we see it in our profession, even outside of our community. We see it every day. We see how, you know, you have to fight to be seen. You have to fight to, we only have so many dollars for education, and we can't provide that education. But how did Karen get to go? How did Sarah get to go? Why can't Tanika go? It's like
I couldn't even take a couple of hours to take a test to study to take a test.
It's gatekeeping.
It is at its finest.
It's 201 now. It's on a different level.
It's 201.
It's on a different level.
It's sad.
Because,
it's really sad.
To piggyback off of Tanika's point about Epic, where I work, we don't have a certified Epic trainer.
Wow.
My training consisted of watching a video of an Epic certified trainer. Wow. That's training.
And see, I've been an Epic super user for years.
Getting ready to be a dinosaur itself. Some of those, when you don't see people qualified to train some of that IT stuff, that to me is not that you couldn't find, not so much that you couldn't find it, but those people are no longer there because they're somewhere else. So now my question is, where are they? So what is the next thing that's coming that all of those people are no longer willing to do this? Because they're there, but where are they?
They're in tech.
I'm gonna tell you what happened.
Something else is happening.
Like they're in tech.
They're in tech.
You're right. They're not. And Epic is this small now compared to whatever else is coming, and that's the reality.
Well, you know, Optum is what's gaining momentum right now. Optum is gaining momentum. Everything is an Optum. I just went through an Optum implementation at my last hospital. Everything is Optum. Everything is Epic. Cerner is kind of cooling off right now. But the other side, have you all heard of CloudMed or Revent? They're now so DRD validation. But the thing that made CloudMed so marketable is their reporting and health informatics features that they can offer. Any code that they put into their system, they can give you a whole overview, how many times it was used, the reimbursement behind it, how much money you lost, how much money you could have had. A look into the future. It's the technology behind CloudMed, not so much as the company. It's their technology that makes them in high demand right now.
And the ease of use and being able to capture that information quickly and in a format or in a manner that can easily be disseminated to that higher level. So
that management level.
Yeah.
Right.
In a language that they translate just on administration and business and numbers.
And even though, to your point, even though Cerner doesn't have a lot of, they got government. so they good. They good.
I like Cerner because it's like an Excel spreadsheet.
They
So I like Cerner.
They good. They sitting good.
Yeah.
Wow. This has been a lot. This has been a whole lot. I love it. Look at the 50. We got a lot. Look, I got some to-dos. I got some stuff. Look, when y'all see me in y'all inbox, like, okay, Mr. Jesse starting the organization. What y'all
We really need to hop on that. You have my full buy-in. We really need to hop on that. So
That's right. That's right. See, that's what we're gonna do when we do the live session, when we have the in the spring. That's what we're gonna do. See, y'all
Don't be entertaining me with a good time and then went to Philly and left me. Jesse, she went to Philly and called me.
This is gonna be a members only interaction. So if you're a member, you can come on in and that'll be the first meeting of the membership. Girl, wait a minute, hold up.
Wait a minute.
Oh my goodness, this was great. Well, some of I had some more questions, but I think we didn't actually touch on all of those questions. We talked about some skill sets and where we need to go as far as, making sure folks understand what those next level skills looks like. Because you may have that foundation of coding and you may be a bomb coder and you've certified and you've done all the things, but look around, you that may not exist the way in which you're doing your job today. And so you may need to think about what those next level skills are and making sure that you're researching that. And I tell people all the time to stop asking little kids what they want to be when they grow up, because that job may not exist right now. So,
right.
Wow.
And LaShanta, I think you said something that was just like everything to me. Like she's done fighting over the VP. She's gonna be her own VP. Ma'am, CEO all day. Nobody's playing. CEO. So every now and again I think about, do I want to go back here into the corporate world? Why? I'm doing everything
Don't
that I
do
was
it.
doing in the corporate world right here.
Yeah.
And providing the same of information and impact. And as soon as I finish all of this stuff in government contracting, we'll be providing some other opportunities as well. Nobody's playing.
No. Clarice, you know what I asked my 2-year-old son now?
Formed Black Medical Health Information Association. I'm trying to put a name out there.
I like it. I like it.
In the atmosphere. Come on, y'all. Y'all know how it goes.
Yes. It's funny that you say that about kids, Clarice, because I have a 2-year-old son. And what I ask him now is,
she went back
what you want to be.
No, let me stop. Go ahead, carry on.
What I asked him now is, what do you want to create when you get older?
Nice question.
That's what I ask him. And just to get that brain going at 2, you can create it. You don't have to jump into something that already exists. Baby, what do you want to create when you get older?
Right.
I love that.
Yeah.
Oh, I love that.
Monique, I'm going to reach out to you for a consultation.
Okay.
I was thinking the same thing when she first started talking. I was like, this ain't right. 17 in the office talking about she need an hour.
And I'm going to pay you for your time. I don't want no freebie.
Okay, Jesse. What did you say, Clarice? I didn't hear you.
Other announcements that she needs to make. So I will give you the floor to make the additional announcements that you need to make.
So we are hiring. Performant Corporation is who I work for. We are hiring for an inpatient supervisor. We're hiring for an inpatient quality supervisor as well for QA. We're hiring for inpatient auditors and outpatient auditors as well too. It's a very good company to work for, and especially if you're an auditor and want to audit the traditional way and not be involved with all the extra BS that comes along with it. Please go on Performant Corp's website and apply.
Can you give the website information?
Let me see. I don't want to tell you the wrong thing. Performant, so PERFORMANT, CORP.com. And I am the manager of medical review there, and our director is assistant.
I do it right.
Yes.
So I put the website out in the chat so that you can see. Mr. Jesse, I don't know if you can put it out there.
I don't know if you guys can see it in Clubhouse. I put it in Clubhouse.
Thank you, Joshua, for those on Clubhouse.
If I spelled it right.
This was good. Okay, so let me just ask you a off-the-cuff question before we end up today, because I could see we could be here for a couple hours, but I don't have that kind of time today. Anyway, room, desk, or car? Which do you clean first? Asha?
Room.
Oh, Monique
I
said room.
was gonna say that.
Room. I don't have a car.
I said room too.
And I'm about the car because it's smaller and it's easier, and I know I can complete that task in a quick amount of time.
I have to be in a clean space, like first.
But it could be overwhelming if you look at the whole room. It's like, oh, this is gonna take a long time. Versus my car, and I have checked off something and I feel accomplished.
I just got to keep my son out my car. That's the problem. Like,
children wreck your whole world.
He disrespectful.
That's you got some time. You got a whole 2-year-old. Leave that baby alone.
Disrespectful, Aisha.
Wait till they get out.
I have a 22-year-old that still leaves stuff when I see her in the car. So I don't listen.
Wait till they get out of the car seat and you lift those car seats out and you see stuff from. Like, what in the whole world was this?
I found a whole Happy Meal behind his car.
That's a petri dish.
Bam. We
a whole Happy Meal.
Just say that when I had two in the car seat at the same time, and when they both came, I did a whole happy dance around my car. It was beautiful.
I know. I did too. It's not easy.
Okay, everybody, this was absolutely priceless. This was great. This is exactly what we needed for our 50th episode. I'm so excited that you all, and so glad that you all was able to join me today. Join us today. I'm sorry, Mr. Jesse. Join us today. So, panel, before we close out, let me just ask you, Miss Monique, do you have any closing thoughts? Is there anything that you want someone to, even if they haven't listened to the whole thing, just a quick, brief, 30-second takeaway for today?
Be your own advocate in coding. Until we start this association, be your own advocate, because nobody is going to rally for you more than you. And so if you feel that you're lacking in certain areas, or that you need assistance in certain areas, if your manager or supervisor isn't giving that to you, go out and find it yourself, because that way you're paving your own future and your own roadway to success in the coding field. You have to be your own advocate until you can find a tribe.
Yes, I love. So when you see that on my pages as a quotable, and your name on there, just know that and I feel like that is the beauty and the birth of what this is right here, because it was like, I don't see too many people that look like me providing the information about coding or health information or whatever. And so instead of knocking on folks' doors and asking and begging and whatever, here we are. Yes. Here we are. 50 episodes later, here we are providing that information. Miss Asha, do you have any gems that you or tea you would like to spill?
Well, I can only go back to what Monique said. You have to advocate for yourself. You have to find what you need to find. You have to find your people, essentially, so that you can grow. So other than that, I think you guys, Tanika, on the side, like when you find like-minded people, it definitely undergirds you and helps to encourage you. So at least you know, okay, I'm not, like, I really didn't understand the culture that I was coming into. I had one idea about it and if I had fire, I was like, not so much what's happening here. But you have to find your people, and you do have to be your own advocate. I think that's the one thing I came to the table with, and understanding that there has to be some kind of alliance for us and for the next generation. So I know we're talking about people currently in coding, but I'm looking also at how can I bring it into the high schools, because this is something that a young person can do. And there is no age limit necessarily at this time for this type of position and this knowledge that they can bring into their adulthood, and they could still become a nurse or a doctor and all the other things as we said earlier. But we can get it, if we can get it from there and almost grow them up into the industry, then we probably already have the IT specialist. And I don't need to necessarily have to create my own school now that I'm sitting here listening to all of you. I've got 3 or 4 different people here, and a nice coach, Tanika, that really, if that's something I wanted to create under and on this platform, I look at all the resources I had that I did not have 2 years ago. So I have to take my hat off and say thank you to you guys.
And Mr. Jesse, as always, you know I am going to give you the last word on any closing thoughts.
I'm just going to expand on what Monique said and basically create your own opportunity. If you can work as a coder, you can run a business. There is more than enough opportunity out there. Don't put all your eggs in one basket, and don't let anybody stifle your career.
Yes. I love it. So look at us spilling all this tea with honey on the 50th episode. It's overflowing. The honey is overflowing. The honey was part of my daughter's idea, because she was like, well, you're doing things in love, and honey provides love and comfort. And I think she probably was thinking Winnie the Pooh. That's neither here nor there. So I want to also shout out all of those of you who have rocked with us each and every week live. Those who were from the beginning in Clubhouse when I had no idea what Clubhouse was and I was playing around. And you all coached me and walked me through what back channels were, what the little moderator sign was, what does people flickering mean? What does that mean? Y'all walked me through all of that. So I want to thank all of you all, and then even those of you who have started joining us when we start using StreamYard with Facebook and LinkedIn and YouTube. And so you guys have just you help troubleshoot our audio. You give us comic relief. And you also engage in our tea spilling. And so I just want to thank you all for being with us and rocking with us for 50 episodes. I prayerfully and Lord willing, we will have 50, 100, 1,000. We're going to speak it all into the atmosphere. More episodes to go. And you all are the reason why I show up every Saturday, because some days I just want to hold on to my covers and lay down. And sometimes my husband looks, well, where are you going, sir? I got to get up. It's 6 a.m. over here. I'm up trying to put all of this together. And so he's like, okay, whatever. I know you got to do that. Yes, I do. So you are the reason why I show up. And thank you so much. I really, really appreciate you. This is so much fun, and you give me the energy needed to go on, and allow me to have my tea, the tea that I have and that I drink all the time, because Lord knows I know Mr. Jesse gonna bring it. So,
every time.
I always count on him bringing some of tea, and I love it. That's why he is my co-host.
Love it.
So thank you all again for joining this Saturday morning
tea.
For my panel, if there is any time that you want to join and come in, all you got to do is shoot me an email. I will give you the link. You come on up, and we will do this and have a good time again. So as I always ask, was the tea spilled today?
Absolutely.
So again, if this information was valuable for you, help us share this message with others by liking the video, sharing the video, and subscribing to the channel at PRN Coding EDU. You can also check out the Coding Nurse channel on YouTube. Monique, I don't know if you have a channel. Do you have any other things?
No, my email, my first name is Barbara. So my email is barbara@jacodingsolutions.com if anyone wants to reach out with questions.
Okay. Check out Miss.
Okay, I was looking for you on Clubhouse, so I was like, okay, so you said that confirmed it.
Yes, and remember, for those of you in the Clubhouse room, just network with each other. That's what we're here for. Mr. Jesse will be giving us our marching orders on the organization. Look, I'm putting that on.
We really do. We really need to do it.
That's right. Because I feel it in my spirit. I feel it. I see it. And y'all know I got paper, so I'll be writing all these notes down and putting it together. Because once you
now, let's be very clear.
The plan,
before we go,
yes,
let's be clear. I will spearhead it, but you know, Clarice, you cannot put me in front of no mic.
He's the family member that you can't put on speaker. And don't tell nobody, or don't tell him, because his tea will be spilled.
Well, just let me know. Whatever you need, just let me know.
That's right. That's right.
And that is what I love.
That's right.
I
love that about him. Amen. Amen.
We need more of that.
Period.
Amen.
So that's why I love and appreciate you. And I've told you a gazillion times, you are family. You for real.
Mm-hmm.
I receive it, but I still don't need to be.
I get it. We'll just turn your mic off when we need to. That's cool. So again, this has been a great session today. I am so full. Thank you all. Thank you all, those on the panel, those who are joining us. Again, don't forget to share the information, because the more we share the information with like-minded people, the more we can get things moving and start that advocation that we talk about. So yeah. So again, remember, be safe, be kind, and don't wish for it. Work for it. Until next time, thank you so much and take care.